Hello friends, now I would like to deal with ENT. In this I would like to explain you or I would like to deal with diseases of external nose. So right now I would like to deal with diseases of external nose. So if you see the external nose, as you know, all the diseases can be classified into majorly 5 types: congenital, developmental, inflammatory, traumatic or neoplastic. Right? So congenital are those diseases which are developed since birth. Next, developmental are those between birth and a few days after a few days in the intrauterine life and after birth. And inflammatory are some infections or due to some infections or some other causes resulting in inflammation, or it may be traumatic, which is post-traumatic, which may cause some deformity, or it may be some neoplastic lesions which may be benign or malignant. So all these 5 are the major factors which would help us to differentiate the different types of anomalies of any organ of our body. So first, right now, let us deal with defects which may be post-traumatic, that is after trauma. These defects may be post-traumatic or they may be developmental defects, right? So they may be some developmental defects or they may be post-traumatic defects. So these defects, these defects are basically the indications of rhinoplasty, that is reconstruction of the nose. So these have 2 major problems. One is cosmetic issue and the other is functional issue. Cosmetic issue, if you see here, so let's see indications of rhinoplasty, because these post-traumatic or developmental defects are necessarily involve rhinoplasty. What is rhinoplasty? Rhinoplasty is reconstruction of the nose. Right, so the major 2 indications are, one is cosmetic indication, which is the most common cause which we see in our everyday life. So this most common cause is post-traumatic, and the most common cause of cosmetic rhinoplasty is post-traumatic, because after trauma, because of some loss of some structure of the nose or some part of some defect, due to some defect that may cause trauma, that may cause some cosmetic problem which lays an indication for rhinoplasty, and this is generally preventable. So this is post-traumatic. This may cause this may be an indication for rhinoplasty. This cosmetic type of problem, it is generally preventable, right? And this may be due to some, and this cosmetic events after trauma, they might have been reported due to some inadequate treatment or some wrong treatment, wrong drugs, or poor treatment, inadequate treatment, right? So that may be an indication for which is a cosmetic indication for rhinoplasty. The other indication is functional indication. So here the external nasal deformity which is seen, that deformity which may be due to any type of deformity that may lead to if it's more bigger, this may lead to obstruction of nose. Once there is obstruction of nose, there may be difficulty in breathing, right? So there are not only the deformity, but the deformity may lead to deviated nasal septum, which causes obstruction of the nose, or the deformity may lead to decreased Cottle's angle, right, which causes obstruction of the nose again. Sometimes even collapse of valve may also result in obstruction of nose. This collapse of valve is mostly common at Lyman Nasal, which causes obstruction of the nose. Once there is obstruction of the nose, the patient can't breathe with the nose, so he adopts mouth breathing, which is really difficult for the patient. So due to that, the patient may opt for the rhinoplasty, right? There are majorly two different indications of rhinoplasty. One is cosmetic indication and the other one is functional indication, right? So now, what are the deformities, right? Now the major topic is the deformities. It's important for us to know what are the types of deformities, right? So these are basically of two types: midline deformities, which are seen in the midline, or lateral nasal deformities, which are seen away from the midline. So midline deformities are basically hump, saddle nose, tip deformity, and if you see lateral, it may be crooked nose or deviated nose or alar depression. So all these may be the deformities. So let's learn each of them in detail, right? So the first deformity which I would like to just a minute. So the basic deformity is first one which I would like to discuss with you is hump. So this is the hump of the nose, if you see. So this is the hump of the nose. You can see here. Sorry. The person has some elevation, so that is the hump of the nose, which after correction it became like this, but before it was like this. So the hump of the nose, what are the etiological factor or reason for hump of the nose? It includes increased or excess bony, or it may be due to excess bony or cartilaginous skeleton, right? The excess bony or cartilaginous skeleton leads to this hump. Generally, no functional disturbance is seen, right? Generally no functional disturbance is seen, and this is so there are no clinical features because there is no disturbance at all. So what do we do for it? It's just a cosmetic problem. So we generally do it reduction rhinoplasty, that is removal of the part of the nose, the part of the skeleton which is excess. So here in reduction rhinoplasty we resect the excess bone, or if cartilage is seen that is resected, right, we resect the excess bone or cartilage by osteotome or knife. Okay, once we have resected the excess cartilage, then they do median and lateral osteotomy. Why is it done? The reason is to narrow the bridge. So this is what is done in reduction rhinoplasty. Here this hump is seen here like this, or if you wanted to see the typical hump, it should be something like this, right? So this hump which is seen, this is generally this doesn't produce any symptoms, so it can be left in that way, but as it may cause some cosmetic problems, it can be reduced by reduction rhinoplasty. I have written it as rhinoscopy. It's not rhinoscopy, it's rhinoplasty, right? So this is about the hump. Sometimes if you see, there is pseudo hump which is formed. Pseudo hump, right? So this is the pseudo hump. But what is this? Once if you look at the picture above and the picture below, both of them generally look the same, right? Even here there is a hump and here there is a hump. But why is it called a pseudo hump? The major reason for calling it a pseudo hump is it is not formed by a bone, but it is formed mainly due to septal cartilage which is subluxated. That is, it should be in a particular position, but it undergoes subluxation, right? So first what happens is, but how is it caused? Just let us, if you know the etiological factors, etiological features, then you will know how it has caused the pseudo hump, right? So there is a septal cartilage in the nose, as you all know. This septal cartilage is subluxated, that is, it has changed its position, right? Subluxated from maxillary crest, that is the major position of it. The initial position is maxillary crest, so from the maxillary crest it is subluxated, right? And then, or there is increased resection from maxillary crest. It may be subluxated or it may be changed. It may have changed its position, or there may be increased resection during some surgery. Both of these leads to loss of tip support. You know, our nose tip needs some support. So this support which the nose tip needs was lost, right, due to the subluxation of the cartilage. So this loss of tip support causes columellar retraction. Columellar retraction. This leads to acute nasolabial angle. And decreased nasal height. Even this has no symptoms, it's just a cosmetic abnormality. If you see it this hump majorly it has resulted in columellar retraction. Finally, if you see the angle here, see the angle here became acute, right? And there is decrease in nasal height. Generally the nasal height should be in this way, but here see there is decreased nasal height. So what do you do for the treatment? The major treatment here is one, treat the cause. Always if you wanted to give effective treatment, you will have to treat the cause. Here the cause is septal cartilage subluxation. So what you have to do here is reposition the septal cartilage which is subluxated, right? So that is the major correction, and along with that you should give columellar support, right? Plus columellar support. It is the major what do we say, treatment for pseudo hump. So right now we have completed hump and pseudo hump. Now let us deal with saddle nose deformity. So in saddle nose deformity, if you see, it would be something like a saddle nose would be like this. A saddle nose deformity for a person, it will be something like this, and later after correction it would be something like this. So the saddle nose deformity is mostly, if you see the etiological factors, it may be caused by trauma most commonly, that too due to accidents, or the trauma may be due to anything, or injury, or it may be iatrogenic. Trauma may be iatrogenic again. So this one is trauma, or it may also be due to some infections like syphilis, TB, leprosy. So the main treatment for the saddle nose deformity is augmentation rhinoplasty. This is correctly opposite to reduction rhinoplasty or reduction rhinoplasty. Here in augmentation rhinoplasty you will add some material, like for example here you may add cartilage or bone or synthetic materials may be added. And then a columellar stud is used if there is columellar retraction. If there is columellar retraction, then we use something called as columellar stud to correct it, right? So this is about saddle nose deformity. Now coming to the other type of deformity which is seen in external nose deformities, and which is seen in many of them, is one, tip deformity. So if you see tip deformities, these are most difficult to correct surgically, because these are at the tip, so it is difficult to correct surgically. So the surgeons should be experts to do tip deformities. So it is of different types. One is bulbous tip, that is tip is something like a bulb. or something with bulb tip is like a bulb, or it may be narrow or pinch tip. It is something like this, pinch tip, or it may be bifid tip. That is, there are two tips. Sorry, something like this, bifid tip, or it may be under projection, or it may be over projection, right? Both these may lead to tip deformities. So how do you correct these, all the tip deformities? These tip deformities can be corrected either by internal or external rhinoplasty. So rhinoplasty is the only procedure which is most widely used for the deformities of nose. So internal or external rhinoplasty. So if it's the bulbous tip, if you see, how do you correct the bulbous tip? If this bulbous tip is given, then okay, let me write, okay, I'll write here. If bulbous tip is given, then what you will have to do is, you will have to first divide the lateral crura of two lateral cartilages. So here you will have two lateral cartilages, so you will have to first divide the lateral crura of two lateral cartilages, that are lower lateral cartilages, right, in two strips. One is medial and the other is lateral, right? First medial strip is rotated, and then sutured in midline, right? So this is done for the bulbous tip. So here there is a bulb like thing, so here you will have lateral cartilage that you will cut like this, in such a way that there is lateral one and medial one. Medial one, what you do is you combine those both and rotate in such a way, and it is sutured to get a good look. And then we give, and then the other thing is narrow or pinched up nose. For narrow or pinched up nose, we can do multiple incisions are given. Multiple incisions are given to open up tip in this narrow pinched nose. If bifid nose, this bifid nose is basically, bifid tip is basically due to two medial crura which are failed to join. So here we suture those two medial crura which are failed to join. So suturing the two medial crura results in correction, right? So these are the tip delivery techniques. We'll deal it clearly in different surgeries which we learn in our future, but this is the outline of the tip deformities. Now coming to the other deformity which of external nose, which is crooked nose. Crooked nose, as the name says, the nose would be crooked. It would be something like S-shaped or C-shaped or undefined, right? The nose may be like this, or it may be a little like this. You know, it's something crooked because of S-shaped or C-shaped. That too, this is nasal dorsum. is S-shaped or C-shaped, that is, it is not generally in the general framework. Now this may be cartilaginous or bony framework. So how do you correct it? It is corrected by lateral and medial osteotomy, that is, the excess of the bone is removed first of all, and then if there is cartilage is increased, if there is excess cartilage, then even that is released. Basically the excess cartilage is septal cartilage. The septal cartilage is released from upper lateral cartilage. By intercartilaginous incision. Right? We give an intercartilaginous incision and we will release the septal cartilage. Now coming to the one more deformity, which is deviated nose. Here the nasal dorsum is deviated from the midline. Nasal dorsum is S-shaped or C-shaped in our crooked nose. Here the nasal dorsum is deviated. Again it may be bony, or it may be cartilaginous, right? So now here, how do you correct it? Just it's the same way, by proper septoplasty if it's cartilaginous, and also release the septal cartilage, release the septal cartilage from the lateral cartilages should be done if the lesion is cartilaginous. If the lesion is bony or both, this is if cartilaginous. If it's bony, what happens? If it's bony or bony plus cartilaginous, then you should do lateral and medial osteotomies, right? Fine. So now these are the different techniques and the deviations of the nose and external deformities of nose. Now coming to the one of the condition which is called as, this is a new condition, which is Rhinophyma or elephantiasis of nose. It is called as Rhinophyma or elephantiasis of nose, or it may also be called as cystadenofibroma of nose, right? Rhinophyma of nose, elephantiasis of nose, or cystadenofibroma of nose. So it is basically a benign nodular enlargement of tip of nose. I will try to show you a picture. So this is Rhinophyma of nose. Here, if you see, here you can see this Rhinophyma, where there is nodular enlargement of the tip of the nose. Here there is benign, it is a benign condition, and it is a nodular enlargement of tip of the nose, as you can see in the diagram. So here, but what is the major etiological factor of it? Etiology. Etiological factor is basically because of it may be due to, first, there is acne rosacea, which is a skin condition. When this is in last stage, this may lead to a complication, which is hypertrophy of sebaceous gland. So acne rosacea, which is a normal condition, this may lead to hypertrophy of sebaceous glands of skin. If this hypertrophy of sebaceous glands of skin occurs at the tip of the nose, then it is called as Rhinophyma, right, or elephantiasis of nose. So there is nodular enlargement of tip of the nose, and histologically speaking, if you see, there is increased sebaceous glands, as we have already said, because it is due to the increased sebaceous glands itself. So there is increased sebaceous glands, that too size and number is increased. Then there are fissures. There are fissures with glands and debris, right? This is the histological feature which you see. It might be something like, if I have to draw this, I might be drawing it in this way. If you see the sebaceous glands, this is one sebaceous gland. These are the sebaceous glands which are seen, right? And this is one fissure with debris, and there is sebaceous glands again. So this is other fissure with debris and sebaceous glands again. So this might be the structure which I feel that through my imagination. Next, what are the clinical features of Rhinophyma? The major clinical feature is swelling in lower half, as you have already seen, which is nodular swelling, and the treatment of this is basically, first, all this tissue which has been swollen, that should be removed first, right? Removal of pathogenic tissue, but we shouldn't disturb the bone or cartilage. Just the pathological tissue should be removed, and then after removing the tissue, you should regrow the skin, right? If cartilage is exposed, then instead of regrowing the skin, you have to keep a skin graft, right? This should be done for Rhinophyma. So the instrument used for Rhinophyma surgery is basically a radio frequency knife, with loop shaving technique. So this type of an instrument is used for the technique of Rhinophyma. This is the instrument which you generally use, which is a radio frequency instrument with loop shaving technique. So these are the loops. So this is the instrument which is used for Rhinophyma. Right. Thank you friends for listening my video, and if possible, if there are any mistakes, just let me know. Thank you for your cooperation.